I'd like to introduce Dr. Deanna Windham from the Whitaker Wellness Institute in California, United States. Thank you for joining me, Deanna.
It is my pleasure, and thank you for having me, Linda. I appreciate it. I appreciate this opportunity to speak to all the people that this is going to go out to.
Thank you. Could you tell us when you first heard about LDN?
Yeah, that was actually kind of interesting. I believe it's about 6 years ago. I've been having a hard time tracking down the exact time, but about 6 years ago, we were establishing our adjunctive cancer treatment program at Whitaker Wellness. And by adjunctive treatment, we do a lot of things to help people who are going through cancer. None of us are oncologists, but we do a lot of therapies to help people have better outcomes. And as we were doing that, we found low-dose naltrexone. And Dr. Bahari was kind enough to actually talk to us by phone conference at that time during one of our doctor's meetings and explain to us about low-dose naltrexone, how it worked, the mechanism of action, his experience so far, and we have been using it ever since. And it's been a really a wonder for the patients in our practice.
So is it mainly cancer patients that you use LDN for?
We do use it for all of our cancer patients, but we also use it for autoimmune disorders, neurodegenerative disorders. Neurodegenerative is anything that starts in the brain and gets worse over time. I've even used it for things like allergies and asthma. I've had some patients with asthma with bad cases that have had to go to the ER, are on multiple medications, and now are on only supplements and low-dose naltrexone. And I've even used it for hormone balance when I have women that are having, even with bioidentical hormones, having a hard time getting a good balance. Low-dose naltrexone can often help with that. So we use it for a wide variety of conditions.
Mm-hmm. And when people normally first start, do they report any side effects?
I always explain to my patients that about 20% of people when they start are going to have difficulty sleeping. That's about what I see as 20%. In most of those people, it may be a little bit higher, but in most of those people, within the first few days, it wears off and it's not a problem. For the patients in whom it is a problem, we can always start at a low-dose naltrexone and build up, and that seems to work very well. Every once in a while, somebody has an unusual side effect where they just feel strange on it, and they describe that in different ways, but they just don't feel quite right. But that is extremely rare. I think I've had it happen maybe once a year in the last 6 years, and that also can usually be overcome by starting at a lower dosage.
Mm-hmm. So do you normally prescribe liquid or capsules?
We usually prescribe the capsules. I've used the liquid in patients that have multiple chemical sensitivity, so they're very sensitive to multiple things, so we want to increase them by the tiniest dosage. So in multiple chemical sensitivity, I use the liquid, and also in pediatric patients.
Mm-hmm.
But most of the time, I'm using the capsules.
And your pediatric patients, do you use cream?
No, we've never used the cream.
Mm-hmm. And for children, what conditions are you treating?
Also in children, the same sorts of conditions, sadly. Cancer in children, asthma. I treat a lot of asthma for kids, and it does really well for them. Kids that have juvenile onset rheumatoid arthritis or other autoimmune diseases.
Mm-hmm.
Those are the main. I also in kids, we're seeing more and more ulcerative colitis, Crohn's disease, and inflammatory bowel disease in kids. And so, of course, I use it in all of my kids that have bowel disorders.
Mm-hmm. And what kind of dosage do you give children?
it depends on their age and their size. And usually somewhere between 1.5 to a maximum of 3 milligrams, unless they're teenagers, in which case they can pretty much be treated like adults lots of times.
Mm-hmm.
But, it does depend on the size. I have one little girl, she's 7, and, excuse me, and she's very slight. She weighs about 37 pounds. And so with her, she's only on 1.5 milligrams and doing very well. And then, we'll go up to the dosage that seems to help without side effects.
Mm-hmm. And what sort of time?
We usually make.
Sorry.
Sorry about that. I didn't mean to interrupt. I was just saying we usually make jumps of no higher than 0.5 milligrams at a time. It seems to work well.
Mm-hmm. And what sort of time frame have you noticed that LDN starts to show some improvements?
It's very interesting. Some people get a very quick response, which, in Western medicine we would probably call a placebo, but the quick response seems to be maintained. So by a quick response, I mean that some people tell me the day after they started the low-dose naltrexone, they start to feel better.
Mm-hmm.
And I had one woman that had allergies for 40 years that were almost debilitating, and she couldn't get anything done in her day before noon because she was dealing with such severe congestion and problems in her throat. And the day she started taking low-dose naltrexone, those problems went away. And then, of course, with MS patients, I have a lot of MS patients who are on low-dose naltrexone, and we do have a lot of treatments for MS. I have probably a dozen or a couple dozen patients that start their low-dose naltrexone and start to feel better practically immediately, and they never actually go to any of the other therapies because the low-dose naltrexone alone seems to be holding them very stable, and they can notice improvements the first week they start taking it. Often, though, it does take, I tell my patients to be patient with it, and that if they don't notice benefits right away, to give it 1 to 3 months.
Mm-hmm. Interestingly, we found that by 4 months, people have usually noticed something. But in a survey we did, there were some people that stabilised. And if you've got a progressive disease, not to have any progression is still a big deal. But then they've noticed after 15 to 18 months, which is such a long time, that their symptoms start to recede. So that's a strange one.
Yeah, I think when I say that my patients are responding, the first signs that they notice
mm-hmm.
that the medicine is starting to work, that's usually fairly early. Not in all the patients, but I would definitely say in 50% at least, that most patients are noticing some changes in the first 3 months.
Mm-hmm.
When they're getting actual regression of the disease and the process is reversing, like specifically in MS, everything's a little bit different. So speaking in generalities is a lot different than speaking in specifics for a disease process.
Mm-hmm.
For MS or other autoimmune diseases, those can be, it depends a lot upon when the patient starts. So if they're starting and they're actually already fairly stable, but they're just looking for something to help, then of course it acts faster. If they're already in an exacerbation or they're having rapidly progressive, then it takes longer to respond. So those are the people that are going to be noticing changes more in the 6 to 12 month range.
Mm-hmm, mm-hmm. Okay. So if a patient came to you and said, okay, LDN isn't working for me, how long should I take it before I stop?
Oh, I would tell them to take it for a year or two. What I explained to them is that low-dose naltrexone really has no side effects. Assuming they're sleeping well, there are no side effects to taking low-dose naltrexone. And what I tell patients is this is increasing your endorphin levels. There are no side effects associated with better endorphin levels. It's all good news. So you can't do any harm to yourself. And if you can help this process and it takes a year or two, it's worth it to do it.
Mm-hmm.
And people are glad to do it.
So how would you summarize LDN in your opinion?
And, that's a question I've actually been ruminating on. And LDN is very hard to summarize and eloquently. What I would say from my experience is that the increase in endorphins that low-dose naltrexone provides can be extremely beneficial to the immune system, and both the immune and endocrine system, that many disease processes are associated with these. And so it's a drug that, while underutilized, has extreme benefits for people and can really make a difference. And I've had some personal experience with low-dose naltrexone because I myself had systemic lupus, and I say had. The correct medical way to put it is that I'm in remission, but I like to say that as long as I stay on my healthy program, I am in effect cured. About 8 to 9 years ago, I was really sick with systemic lupus, and I was getting sicker and sicker to the point that my doctors told my husband that he should just expect to be a widower because there was no way that I was going to make it as sick as I was. And now, through a process of, I did a lot of things, supplements and hyperbaric oxygen, and I had to detox off of mercury. But the low-dose naltrexone was also a key component of my treatment, that once I added it in, I kind of felt that I got an aspect of it that I just hadn't been able to treat before, and I felt for the first time that I was actually healing instead of just treating. Mm-hmm. And now at 43, I don't mind saying so, I feel better at 43 than I have ever felt in my entire life. I got psoriasis when I was 9 months old, which, at that time they didn't realize was autoimmune, and have struggled with different autoimmune aspects my entire life that went undiagnosed until I had this systemic lupus when I was at the end of my residency. And the difference in my life with how I feel, how I sleep, lack of pain and lack of fatigue is something that I didn't know people could actually experience. I just thought that was normal for life. And mm-hmm. So this is something that has become a personal quest for me to work with people that have autoimmune disease and to help them to understand how low-dose naltrexone works, that there is hope, that there is something that can be done, something real that can change their lives for the better. And then I really try to get that information out to people and be a representative of that in my life.
Could you just explain for me what lupus is and how it affected you? You mentioned a few of the symptoms there, but could you explain fully?
Oh, sure. Lupus is an autoimmune disease that attacks the connective tissue in the body, and it can attack different systems. So systemic lupus can look different for each person. It doesn't always look exactly the same. Chronic pain in different areas of the body, chronic fatigue are two of the markers, but of course that's not those aren't solely lupus symptoms. In lupus, the organs can also be involved: the kidneys, the liver, the heart, the lungs. Different parts of the body the connective tissues start to get attacked by the immune system. Mm-hmm. And don't work as well. So you start to have problems with many of the organs in the body. And again, it can look very different for different people. but some of the common symptoms, like I said, chronic pain, chronic fatigue, chronic brain fog, happen with lupus, and then along with the destruction of the organs themselves, which is what causes the deterioration.
Well, thank you very much for sharing your experience with us.
It's my pleasure. Thank you for calling me.